Hello, YouTube fans. You're in for a real treat today. Hey, Fred, where's Fred?
I am here. James Taylor has a song. I'm your handyman. Well, I'm your cameraman.
You're the cameraman today. Okay.
Yep.
We'll do a fist pump later.
Yeah.
Fred, people ought to watch our first video to understand why we're doing this. So the why of doing Fred and John Talks. I get a lot of jokes about that because some people ask me, why are you doing this, John? And I say, well, my wife and I don't, nobody at home listens to me, so I have to go on national YouTube to get an audience.
Captive audience.
Captive audience. So today we're going to talk about weight loss, and for the second time we're going to have Russ Lederhouse, who's a PharmD, a pharmacist of quite a few years. How many years total?
17 right now.
17 years.
17 years.
So he has a lot of experience and a lot of background. I met Russ when I was practicing gynecology and doing bioidentical hormones, and he was into compound pharmacy at that time. Has a lot of knowledge in retail pharmacy, compounding pharmacy, etc. But I'll ask him to do a quick bio sketch in a moment. But I think you're going to find this an interesting talk today. The topic of weight loss was something that even Oprah did a special on. And everybody knows Oprah has something important to say. She says it. And she had this show in the last 2 weeks about why she had left Weight Watchers and the companies that were making weight loss drugs like Eli Lilly and Novo Nordisk. So we'll let Russ get into that too. So we're going to have an interesting chat today, and I think you'll learn a lot, and it'll be very informational. So with that lead in, Russ, would you give us just a quick bio sketch before you launch into weight loss?
Sure. So, hi, my name's Russ Lederhouse. What I'm going to be talking about today is all the weight loss drugs that you guys have seen about, heard about, maybe you're trying to get and you just can't. Like your Ozempics and your Wegovys and Mounjaro. The new one Zepbound that's out, Trulicity that works really well, but you just can't get it all. I'll help kind of talk about all of those and the good, the bad, side effects, some interesting things that they're finding out along the way. And we'll just kind of delve into the whole topic.
Thank you. I'm looking forward to it. In my practice of GYN, I would say apart from menopausal symptoms and menopausal complaints, that I want to lose weight was the most common issue and complaint amongst women. And often that is hormonally driven. Sometimes women who are in estrogen excess will retain weight. But it's a full-time problem, and I think women are more likely to be concerned about it than men, quite frankly. So tell us about these new GLP-1 peptide. I guess they're called peptides.
Yep,
it's a hormone.
that's what they are.
It's a hormone.
So it is GLP, glucagon-like peptide 1, that acts like an incretin, or like basically the hormones in the stomach. And what it's doing is, so like when we naturally eat, our body says, "Hey, we're hungry. Let's eat." We eat, we get full. It says, "Okay, now we got enough food. Let's slow it down. We don't need to eat anymore. Stop eating," and it'll just send. Then it'll send messages up to our brain to say, hey, we need more insulin to help break down the sugars that are in the food. Or if it starts to get low over time, then it's like, hey, we need to increase glucagon, and we need to bring up glucagon to help bring up our blood sugar. So it's a balance between the insulin and the glucagon.
So insulin is produced when we eat, right?
Yep. So sugars go high, we get insulin to knock it down.
Right.
And then if we don't have any sugars around in the body, glucagon gets produced and it increases the blood sugar. So what these are doing is it's a glucagon-like peptide, and it's actually shutting that down, helping to decrease the blood sugar levels in the body.
Oh. Okay.
And they're doing it mainly for type 2 diabetics. That's where this is going to help. Now, to kind of go in, like we say, type 1, type 2. Type 1, that's for people like it's a little kid, like they're born with it, or they develop it and they get diagnosed with it early on in age. Type 2 is the individuals like the adult onset. You've gotten older, you've gotten bigger, you've gained weight, and your body's just not able to handle the insulin production like it has been. And that's when you start to get on medications like metformin or glyburide, glipizide, Genumet, Some people need to get on like injectable insulins.
Yes.
Now these products here, they are not insulins.
They were really initially supposed to be just for diabetes.
Yes, that's where they really found where these medications were going to help out was just for diabetes, helping to decrease the blood sugar levels. And it would work in conjunction with oral meds like your metformins you could even use it for somebody who is on insulin and they could use this as well. That way they wouldn't have to be using as much insulin because it's actually helping the body stimulate and increase the insulin production.
Are the peptides and the GLP-1, is that really anything to do with like being bioidentical, like a natural substance? I mean, they're hormones. Right?
It is essentially, so these are natural substances. They are peptides. So it's just like this configuration of amino acids makes up this peptide, and when you put it into the body, it's going to hit a receptor. It's going to turn it on or turn it off, whatever, like however it affects that receptor. Well, in this case, it's doing it by it's hitting that receptor and it's lowering blood sugar levels in the body.
And it lessens the appetite.
Yes, so that's one of the side effects they're finding. Is when people go on these, all of a sudden they just have no appetite at all. To where people would like what they say like food noise, like they're constantly thinking about food. They want to have food. Like some people, they have real issues with food, and like they're a food
addiction.
addict.
Yes. Food addiction.
Well, these medications they're finding out when it goes in, it's actually helping to calm that down, that inner voice or that desire, to where people just don't even have an appetite to eat, and eventually like they even have to like think about eating just because they're not hungry throughout the day.
What are some of the other side effects of this classification of drugs?
Biggest one that everybody will deal with is nausea.
Nausea.
Nausea by far. Whenever you start this medication. Now, these are all injectables. So from the pharmaceutical company, like you go get a prescription from your doctor, it's going to be in a pre-filled syringe. You dial the dose to like your 0.25 or your 1 or whatever your dosage is going to be to start off with. You inject yourself with that. It's a once a weekly dosing.
Once a week. Okay.
Yeah. So you might do it every Sunday. Every Sunday, then after church, you're going to come home, you're going to dose, like do the pen, and you're going to dose yourself. And it is so long acting, you only need to do it once a week. Because the half-life on these things is up to 5 days.
Wow.
So it takes 5 days for half the drug to break down and for your body to eliminate it.
That's effective. That's effective therapy.
It really is.
Yeah.
But the side effects, because it's so long acting, stick around for a while. And a lot of times it is the nausea factor where people just feel nauseous. So whenever they start it, they need to be on a dose for at least 4 weeks.
Go slow. The body has to accommodate to this change, doesn't it?
So they want to be on that dosage for at least 4 weeks before they step up. And then when they step up to the next dosage, that nausea is going to hit them all over again. It may not be as severe, but it's still going to hit them. And then they're going to be on that next dose for at least 4 weeks. Then they're going to go to the next dosage, possibly.
Okay.
And then they're going to have nausea to deal with all over again. Each step up, nausea is the biggest thing that people have to deal with. And that's what causes most people to stop these medications.
Oh, okay. Not the weight loss, because it seems to be very effective in that.
It can be very, very effective.
Now tell us, you have your own personal experience.
I do, actually. Getting in with all this stuff and started reading about it. But then also I wanted to talk to my doctor, and we decided we were going to do it. But then I couldn't get the medications. It just wasn't available. And that's the thing. A lot of these things, I mean, it's like chasing a ghost. At the pharmacy, I try to order it every day for my patients, and I just can't get it in.
That's what I hear, yeah.
I mean, honestly, Trulicity is supposed to be the top-selling drug right now, but I can't even get it in to have on the shelf for my patients. I just pretty much, if somebody's even coming into my pharmacy like to talk to me about it, I'm like, don't do Trulicity because I can't get it.
Right.
I can't guarantee if it's going to be 2 weeks, 2 months. I have no idea when I'll get it. Now, Ozempics are better. So I have a good time with Ozempic. Wegovy low dosing, very hard to get. There is like Tirzepatide, which is Mounjaro, and also Zepbound is like the weight loss version.
Zepbound is newer, isn't it?
Zepbound's the newest one. So that's the Tirzepatide. It's the same as Mounjaro. Mounjaro is for like the blood sugar type 2. That's what it's approved for. The Zepbound, that's for the weight loss.
Okay.
And that one we have right now, we're having really good results in getting that in on a pretty steady basis.
I think one of the things that happened with Oprah, just getting back to her for a moment, was that her Weight Watcher company was teaming up with Ozempic and hoping that their clientele would utilize that in addition to their regimen of point counting and everything else. And I guess she came into conflict or didn't want to be representing a drug as much as she wanted to represent Weight Watchers.
Mm-hmm.
So she had to bow out. But I'll tell you, the special she did, if you fans of YouTube haven't watched the Oprah special on weight loss about shame and blame, you should really watch it. Another thing that you mentioned to me is these peptides. They're kind of like the Wild West. That's actually why I wore my cowboy hat today, fans, because whenever I talked with Russell about this weeks ago, he really excited me about the different types of actions these peptides have. Mm-hmm. And why each drug manufacturer, the name of each drug, is a little bit different in terms of the peptide they use and the actions they use. And so, wow, I'm going to ask him to talk about that because we're really possibly on the cutting edge of the Wild West in pharmacology and actions.
Oh, absolutely, John. It is.
Thank you.
With this stuff here, like what I'll talk about is, like you have Ozempic, semaglutide. That's your GLP-1. That drug, that peptide, is just a GLP-1. It only hits that receptor in the body.
One receptor.
One receptor.
Specific.
Whereas the tirzepatide, that's your Mounjaro, and your Zepbound, it's actually hitting two receptors. It hits your GLP-1, your glucagon-like peptide, but it's also hitting a GIP, which is your gastric inhibitor polypeptide. Okay. So it's actually doing a 2-for-1. So that protein, that peptide is actually hitting two different receptors and turning it on, as opposed to just one.
Gastric receptor, does that mean that secretions decrease?
Yeah, it's in the stomach. So one of the big things with this, how I talked about nausea. Another thing that's going to happen is gastric emptying. So that's when you eat something and the time it takes for it to empty out of your stomach, go into the intestines, and for it to travel through your intestines. This will slow down on any of these medications. Okay. So nausea is a big factor, but also constipation can be a big factor with this.
Because of the slowdown.
Because it's slowing everything down. Everything's not moving the way it would normally if you weren't on this medication, slowing it down so it can cause constipation. But then people will also have bouts of diarrhea in which all of a sudden they may empty everything all at one time, then they may not go for another 3 days or so. So I mean, it all depends on the person. And we talked about my personal story. I actually started on the Mounjaro, but a compounded version just because I couldn't get the other stuff. It wasn't available to me, so I contacted one of my compounder friends, and I've been getting that, and it gets shipped to me just like it would to you or anybody else if they wanted to do this. Cost-wise, I can tell you I'm paying roughly $10 a milligram. So right now I'm a 5 milligram dose once a week, so it's costing me $50 a week.
And this would do a compounding.
Yes.
Yeah, okay.
And then what I do with this is how it's in a vial, and I get bacteriostatic water, and I actually have to mix this up myself. So I'll draw up the bacteriostatic water,
at home.
Put it in like this little freeze-dried pellet that it comes in. So it's just like what I would do in the pharmacy, like if you're coming in and getting a vaccine. Like with Shingrix, perfect example. That is a freeze-dried pellet that I am adding this bacteriostatic water to, reconstituting it, and then I would give you that vaccination. Well, with this, like the tirzepatide's in a freeze-dried pellet, I pull up the bacteriostatic water, I rehydrate it, and then I'm pulling my doses off of that I'm injecting myself weekly.
Weekly, okay. So this is something that's being mail ordered from your
But
pharmacy.
here's the thing: it is an FDA approved product.
Sure.
In Mounjaro and in the Zepbound, but mine is not. It is the compounded version.
Okay.
And here's your workaround. This is for research purposes only. And that's kind of how they're working around this. It is a natural peptide, but it's only research purposes. They can't say for injection or to treat your type 2 diabetes or to treat for weight loss or anything like this.
So this is what the public is doing right now.
The public is doing this a lot because they're coming in, and here's the deal. If I can get it to go through your insurance, a lot of times I can get it for a $25 copay with your insurance. Okay. If it's not going through your insurance, a lot of them on like a manufacturer card, discount card type deal, they may cover half, but you're still paying roughly $550 a month.
Wow.
A month for these medications.
Yeah. Oof.
And I have patients that are coming in and doing that, and they're happily doing it, and they're putting it on their HSA, FSA accounts, and they're paying it off that way. And then there's other people that can't afford it, but they need it, and then they're going and they're getting this compounded version. I know a lot of people that are doing that and having it shipped to them.
So you're having success yourself.
I am actually. I can tell you the nausea factor is real. I've dealt with that. I don't have an appetite sometimes, and like a lot of times I'll eat breakfast at 6 o'clock in the morning, and then by 3 o'clock in the afternoon I have to remind myself, wait a minute, I haven't eaten today. And but I don't, but I'm not hungry. I don't have that craving. I'm not feeling bad. I just get busy at work and doing stuff, and I just forget to eat. I mean, it seems kind of weird, but you have to remember to eat on this stuff. So I mean, it's kind of scary sometimes.
Well, I'm an old Kansas boy, and I'll tell you one thing: I don't have any problem remembering to eat.
I didn't either until now, but it's weird. But no, in the past I've used it for 2 months now, and I've lost a total of 15 pounds.
Wow, 2 weeks.
And in 2 months, 15 pounds, and I really haven't. I was dieting and exercising beforehand, but I was just kind of plateaued, and I really wasn't making any headway. I was maintaining, and I was slowly gaining muscle mass in the body, but as far as my weight and on the scale, that wasn't moving at all. 2 months ago, I did this. I started off at the low dose, did that for 1 month, stepped up to the next dose, and now I'm at a 5 milligram. So I started off 2.5, then I stepped up to 5, and I've been there. And I've roughly lost about a pound a week.
I know you're not an expert on psychology and behavioral aspects, but do you think that people emotionally will be better off with weight loss, because it seems to be such a big deal? I mean, even Oprah talked about the shame and the blame of people who are
Absolutely
seemingly overweight.
100%. I mean, the way people view themselves, their inner thought, to where, I mean, it's like when you go out and you think, oh my God, my outfit looks weird, or this or that, or my socks don't match. Nobody notices but you.
Right.
It's just like with your body and how you feel about it. You're going to be the hardest critic on yourself. And if you're not happy because you feel you're overweight, or you're ugly because you're fat, anything you can do to help decrease your weight, then you're going to start feeling positive, and you're going to think, I'm looking better, I'm feeling better.
Better for your health
100% it's going to help. Absolutely.
Better for your health long term. Hey, tell me a bit more about the specificity of peptides, because this is the Wild West I was referring to earlier, fans. Apparently, these are really interesting specific effects that may help liver, may help brain, may help heart.
Yeah, now this is kind of what they're finding out with these, because they're brand new. They found out, here's something interesting. This initially, where they found all these guys to begin with, is they were researching Gila monster out in the Southwest. Yeah, that poisonous lizard creature.
Those green ugly things?
Yes, you got it. Well, they found if like you got bit by one, all of a sudden your blood sugar level would drop like crazy.
Whoa.
Well, what was it in that saliva that was causing these blood sugar drops?
Okay.
And way back when, that's when they found these GLP-like hormones, or like chemicals that were in the saliva of the Gila monster. Then that started this whole revolution of where we are now with these Ozempics and Mounjaros and Zepbounds and all this weight loss drug.
Okay.
Is it all started with the Gila monster saliva. But now it's doing even more so than what we're realizing. The longer this is in the public and people have been using this, we're seeing more and more benefits that people are kind of, as a secondary, almost like a side effect, but it's not a negative like the nausea and the constipation. This is more of a positive toward people that all of a sudden had RA, rheumatoid arthritis.
Yeah.
Their hands just feel better. They're not painful. They're not swollen. Their knuckles aren't as bad as what they were. Or people that have, they're finding out with tirzepatide, people that had fatty liver disease, non-alcoholic fatty liver disease, it would actually help to reverse that and help to reverse the fibrosis in the liver. They weren't setting out to get this, but they're finding out, wait a minute, this is actually happening along with this. Another thing they're finding out, which is really fascinating, is people who are addicts for food and that food noise that I mentioned earlier, when they're constantly thinking about it. And like, okay, if they have something sad or something stressful, and like one of their coping mechanisms would be food.
Yes.
It helps to calm that down.
Big time coping mechanism, especially women suffer from that, maybe a little bit more than men, especially during menopausal time frames.
Yeah. But they're also finding out that it's kind of going along with that dopamine pathway and that reward pathway to where people who are smoking with nicotine or with alcohol or with cocaine or with amphetamines, that they're not having that fixation and it's actually calming down all of that stuff. And this is something that, again, I'm just reading about, and I can see this is going to be big in this industry once they kind of focus in and figure that part out and get it more refined. But these peptides, they're doing a lot of good stuff, and it's pretty wild what they can get into.
It sounds like it's like that word from the movie years ago. What was it? Plastics. The big word was plastics. Way back.
Oh, from The Graduate. Yes.
From The Graduate. Plastic.
Yes.
Now the big word's going to be peptides for maybe this century. Before we sign off, you told me earlier there are a couple of really important contraindications. That means in medicine some absolute reasons why you cannot take or be experimenting with these weight loss drugs.
Yeah. The only people that I would caution to stay away from this completely is if they have a history of thyroid cancers in their family, any history of thyroid issue cancer like that.
Okay.
These GLPs can actually stimulate that and make it worse. So do not, if you have thyroid cancer, history of it, do not do these whatsoever. I wouldn't. Also, if you have a history of pancreatitis, any issues with the pancreas, they're finding it's kind of, it seemed like it was more severe earlier on with this than what it is now, but still it's an issue. So anybody with thyroid cancer, history of thyroid cancer in their family, any issue with pancreatitis, pancreas issues, honestly, I don't feel these would be for you.
It might be an issue there because the drug, the GLP-1s, do influence insulin, right? So I just wonder whether that plays into the pancreas either working too hard, working too little, or being inhibited. Maybe there's some things going on.
And that's the thing they got to figure out. But a lot of these mechanisms of actions, and specifically how it's working, why it's working, why it's doing what it's doing, that's the part we don't know yet.
Yeah.
And they're still trying to figure all that out. But if you need to lose weight, these are fantastic. If you need to regulate your blood sugar levels, this is fantastic for that, and it'll do it. Honestly, these drugs are probably going to turn into one of the first-line therapies for type 2 diabetics, or if they have what they call like a metabolic syndrome, where they have issues with their cholesterol and heart health and with diabetes. This is going to be one of the go-to drugs just to put them on.
Given your experience in pharmacology and being dispensing of medications and filling prescriptions, over the landscape of the last 17, 20 years, would you say this is a totally new revolutionary advance compared to all the other weight loss drugs?
100%.
100%.
100%. This is a game changer. Honestly, two of the biggest game changers I've seen since I've been doing pharmacy, as I would say, this is by far one of them right here. How this is helping people manage their blood sugar levels, but also lose weight. But we're not having like the fen stuff that we had years ago.
Phentermine, fen, yeah.
Yep, you remember that. But then people had there was the heart issues and the heart attacks and strokes there was legit concern with that, and that's why I got pulled. We're not having that. There is a lot of benefit with this. Now we need to be careful, just like with the thyroid cancer. We need to keep looking at this and seeing what are the contraindications. Where do we need to be cautious? Because you just don't want to jump into this because we're gonna have there's gonna be other monitoring parameters with this. It's still new.
Well, physicians need to be monitoring this. That's what I would advise, because they may need to have thyroid function studies, liver function studies, and never put the doctor out of the loop, and talk to your pharmacist.
Yep.
Well, I don't know, that's all been very, very educational and informative. Does the Peanut Gallery, Fred, do you have any questions back there?
You guys were so especially Russell, so thorough and knowledgeable matter of fact, before we went on camera, we were talking a little bit, and I was inquiring about how this might help me. In my case, I have kept my weight at a steady 185, between 184 and 186 on the keto diet, and one of the medications that you described would be helpful to me is cost prohibitive. So I don't. That's my personal 2 cents about my own. I weigh only 10 pounds more than I weighed in high school. I weighed 175. I weigh 185 and I'm 67 years old.
I can't say that.
And you were a star baseball player.
I was baseball, basketball, and I played a couple of years of football too. So no questions, but a lot of gratitude sent out your way, Russell. This is our second interview with Russell.
It is, yes.
And we're real excited about it and getting it up on YouTube in the coming days.
We've got to find more topics that are related to the public's interest in pharmacology, medications, and drugs, because you're an excellent good person to discuss these things with us.
Yes.
So again, thank you, Russ,
Absolutely. Appreciate it.
for coming.
Absolutely.
You're the guy.
Right.
Thank you.
We'll sign off. So that's a go.
All right.
That's a ciao.
That's a ciao.